Everybody, it's Alvin Brown, the CEO and founder of the Center for Healing and Peak Performance and Integrated Peak Performance Consulting Services. Also, author of Journey to Personal Greatness, Mind, Body, and Soul, available September 15th, Amazon, Barnes & Noble, Books A Million, and Chapters Indigo in Canada. We're going to take pieces, this whole series we're doing is about helping you get to your personal greatness and also for peak performance. This time it's called Short and Sweet. We're going to focus on the adrenals. The adrenal gland is something that a lot of us, the buzzword, but we want to give you more information on it. Over the next 4 segments, we're going to talk about the adrenals. From Dr. Mina, we'll talk about the technical side of it, how all the mechanics of it, how it works. And then we're going to invite our assistant, Dr. Mina's assistant, Don Van Adder, to talk about what you can do, practical examples you can do to help the adrenals. All right, so I'm going to leave it here. We're going to talk about adrenals, but I'm going to let Dr. J. Mina give you the details.
All right, so without getting too technical on the adrenal glands and what it's actually a bigger picture of, what the adrenal glands is really part of in terms of a system is called the HPA axis. So I've written the key points here that we're going to cover today. So the HPA axis is this finely tuned, intricate system where it involves 2 structures in the brain and then also the adrenal glands. So if you caught Don's video last week on the adrenal glands and where they're located, you'll be familiar that they're sitting just on top of the kidneys. But just before that, the 2 other parts are going to be your hypothalamus and your pituitary gland. So all of them are connected, and they've got this harmonious rhythm going where each one of them secretes out a hormone and signals that next structure to secrete out another hormone, and it just goes in this cyclical wave. However, what happens is once we get to our adrenal glands and it excretes cortisol, if we're putting too much stress on our body, whether it be through foods or even overtraining, that can cause too much cortisol to get excreted, and the rest of the system doesn't get to operate and function properly because this part is telling the rest of the brain, don't send me anymore, I've got enough to deal with, just leave me alone from there. But that can cause a lot of problems when it comes to healing, performance, athletic-wise, and just overall general health and well-being. So our cortisol naturally follows a pattern. Actually, these times are wrong, but the highest amount of cortisol you're going to have is going to be first thing in the morning when you wake up. As you go on throughout the day, your levels of cortisol are supposed to decrease. This is now in a normally healthy, rather healthy individual. However, not many of us have this perfect pattern of cortisol. So what we can do is now look at cortisol testing. So now I'm going to get into the last key point, which is going to be cortisol testing. So a few things we can do in office are going to be, one of them is the blood pressure test. So I have a patient lying down straight, still for about 10 minutes, take their blood pressure. I'm going to have them rise immediately, and you'll take their blood pressure again. What we want to see is that your blood pressure will normally rise. This is just an indication that, okay, your adrenal glands can handle the stress of you going from a supine position to standing up straight. However, if your blood pressure drops now, that's a sign that, okay, it's a little too much for your adrenal glands to handle that amount of stress. So chances are cortisol levels are a little bit out of whack. Another thing we can do is a pupillary light reflex, where we're shining a light into the pupil, and what naturally is supposed to happen is the pupil constricts, and it should stay like that. The adrenal gland should be able to handle that amount of stress that you're putting onto your eye. However, if cortisol levels are not imbalanced, that constricted pupil will dilate quickly, usually with under 5 seconds. Another thing we can do is send away for saliva testing. So with the saliva testing, we test the 4 different points in the day. So we'll test first thing in the morning, at lunchtime, dinner, and then just before bed. So what the lab test is going to see, it should see, is that it follows this nice pattern. If not, it'll be able to tell us how far out of normal range we are. And last but not least, we can do blood testing. So it's not the most accurate way, because number one, when they do blood testing, they're only testing that cortisol level at that one point in time during the day. It's not seeing the other 3 points. And then also, typically people get a little bit nervous when they're receiving needles, so that can cause your cortisol levels to spike, so it can give false readings. So saliva is a little bit more accurate when it comes to testing for cortisol.
What in today's society, what's the average graph for people?
There, you know what? Average doesn't need. There's no such thing as average these days. But a lot of times, what's happening is instead of having this nice dip, we're going like this, and we're just going all over the place. We're not balanced at all.
Right, so erratic patterns. Okay, this is short and sweet. Dr. Mina gave us some great advice. Remember the adrenals. If you want to get to peak performance or your personal greatness, personal greatness is not just about getting things or driving hard. It's about having balance. I want you to get there with balance because personal greatness is different for everybody. But having balance is the key because when you get there, you don't want to have all the money and no health. You don't want to have health and no money. Unfortunately, live in a material society. You want to be zenned out, but your body's falling apart. Or it's just a balance. So we talk about adrenals. We talk about the body. We're going to give you information on all levels to drive you to get balanced. Short and sweet. Dr. Mina, Alvin Brown will be back again with another segment of adrenals, and we'll talk to you soon. I'll scroll the number on the bottom. Give us a call. We have 20-minute free consultation sessions to pick our brains, and if you're in the area, great. If not, we also do phone consults and Skype. We do coaching, everything. So give us a call. Check our website, tchp.com, and we'll talk to you soon.